Every year, millions of seniors line up for their annual health checkups, believing they're doing the right thing. After all, we've been told our entire lives that early detection saves lives. But what if, after 70, some of those same tests start hurting more than helping? A growing number of geriatric specialists now say certain checkups can lead to unnecessary treatments, stress, and even new health problems, all for conditions that might never have caused harm. So why does no one talk about it? Because medicine has momentum. Once a habit begins, it rarely slows down. Today, we'll break that silence. You're about to learn the 5 medical checkups experts say to question after 70, and the safer, smarter ways to protect your health instead. Stick around till number 1. It's the one test many doctors now quietly regret ever recommending so often. Before we dive in, how old are you, and how's your health been lately? Drop a comment below. We read every single one. The over-testing problem. In your 30s or 40s, screening early can save your life. But after 70, your body changes, and so does how it reacts to procedures, scans, and medications. The National Institute on Aging reports that many age-related screenings after 70 can trigger what they call the overtreatment cascade. One test, a false alarm; another test, a procedure, real harm. In fact, a review in the Journal of the American Medical Association found that nearly 1/3 of older adults received unnecessary medical testing last year alone. But this isn't about refusing care, it's about understanding it. Because caring for your health at 70 means something different than it did at 40. Now, let's count down the 5 health checkups you should think twice about and what to do instead. Number 5. Full-body CT scans. The hidden radiation risk no one talks about. On paper, it sounds smart. Why not get a full scan just to be sure? Many seniors say it gives them peace of mind, a full picture of what's going on inside. But here's the hidden truth. A single CT scan can expose you to as much radiation as 200 X-rays. Now imagine getting that scan every year. That's like standing in front of an X-ray machine every day for weeks. And while your body is strong, at 70 and beyond, its ability to repair radiation-induced DNA damage slows dramatically. What happens next? Small, harmless spots, called incidental findings, suddenly become medical mysteries. That faint shadow on your lung, that tiny bump on your liver, things that might never cause a single symptom, now trigger waves of anxiety and further testing. A Harvard Medical School study found that 28% of older patients who underwent full-body CTs ended up with unnecessary follow-ups, biopsies, or even surgeries that provided no real benefit. Some doctors now call these scans a Pandora's box for seniors. Once opened, it's hard to close. So what's the better approach? Before agreeing to a scan, ask, will this test actually change my treatment plan? If the answer is probably not, it's perfectly safe and often wiser to skip it. Because sometimes the healthiest decision isn't more testing, it's giving your body the quiet confidence to heal without fear. If you're still watching this video, hit subscribe and share with someone you love for a better health. Number 4. Routine mammograms after 75, when early detection stops being helpful. Mammograms have saved countless lives, especially for women in their 40s, 50s, and early 60s. They've given generations of women hope, confidence, and control. But after 75, something changes, And it's not just the body, it's the balance between benefit and harm. As we age, many of the cancers that appear on scans are so slow growing they might never cause symptoms or shorten life at all. Yet once that mammogram shows a tiny shadow or irregular line, the process begins, and it's almost impossible to stop. There's follow-up imaging, then a biopsy, then weeks of worry waiting for results. And if treatment starts, it can lead to radiation, pain, fatigue, and swelling, all for something that might never have grown large enough to harm you. A University of California study found that nearly half of women over 75 treated for screen-detected breast cancer later said they regretted the decision, not because they didn't value their health, but because the treatment's side effects affected their quality of life more than the cancer itself ever would have. Evelyn, 78, was proud of never missing a checkup. Her mammogram found a small mass the size of a pea. She had surgery, radiation, and months of recovery, and later learned her tumor was so slow growing it may never have progressed. Her doctor called it overtreatment. Evelyn called it a lesson I wish I'd known sooner. So, should women stop screening altogether? Not quite. The key word is individualized. If you're healthy, strong, and have a family history of breast cancer, keep talking with your doctor. Screening might still make sense. But if you're managing other chronic conditions, or if every test adds more stress than relief, it's okay to pause. Because at this stage of life, good health care isn't about doing everything possible. It's about doing what's personally meaningful and truly beneficial. And remember, a test should bring peace of mind, not take it away. Number 3. PSA tests for prostate cancer. The anxiety trap millions fall into. Every man over 50 knows the phrase, "Get your PSA checked." But after 70, that advice changes. According to the American Urological Association, routine PSA testing can lead to overdiagnosis in older men. That's because PSA, the prostate-specific antigen, can rise for dozens of reasons that have nothing to do with cancer. Even mild inflammation or a urinary infection can spike levels. And one elevated reading often leads to biopsies, procedures, and worry even when the underlying issue is harmless. George, 74, went through this exact chain. A slightly high PSA number led to surgery. Months later, his doctor admitted the cancer he removed was so slow growing it never would have spread. But the operation left George incontinent. So what's the smarter move? If you have symptoms, difficulty urinating, pelvic pain, or blood in urine, by all means, test and treat. But if you feel fine, trust your body and focus on prevention. Stay active, manage weight, and eat anti-inflammatory foods. Sometimes, numbers aren't health. How you feel is.
If you're listening to me, subscribe Science Pro Health for more weekly senior wellness videos. Number 2. Annual routine blood panels. When more numbers make more confusion. Blood tests seem harmless, right? But after 70, the opposite can be true. Each new test adds a chance of a false positive, a result that looks abnormal but means nothing. And with age, our normal ranges shift. What's high at 40 might be normal at 75. Rose, 78, went for her annual physical. Her kidney markers came back slightly elevated, triggering a flood of panic and follow-up tests. After 2 months, the verdict. The lab equipment had been recalibrated wrong. So, what's the lesson? Target your testing. Your doctor doesn't need to check everything, just the markers relevant to your health profile. A smart annual review might include basic metabolic function, thyroid, and blood sugar. Nothing else unless symptoms suggested. Payoff? because your health story deserves context, not confusion. Number 1. Heart stress tests without symptoms, the most overused test of all. Heart disease is serious, but the stress test designed to find it can sometimes do more harm than good when you have no symptoms. Here's why. These tests use medications or treadmills to push your heart artificially hard. For seniors, that can cause irregular heart rhythms or false blockage readings that lead to unnecessary stents. A major 2022 study found that over half of all stents placed in symptom-free seniors provided no life-prolonging benefit. Marcus, 79, took a stress test after his neighbor's heart attack. His test showed a mild blockage, and doctors rushed to operate. Months later, a second specialist told him the blockage was tiny and could have been managed with exercise and diet. So, what's the real heart protector after 70? Move daily, keep blood pressure steady, and prioritize sleep. Because your heart doesn't need another test, it needs more calm. So what do we learn from this? At 70, good health isn't about more tests, it's about better decisions. Unnecessary testing can trigger anxiety, overtreatment, and physical harm. But smart, selective testing can extend quality of life. And that's what truly matters. As one Japanese longevity doctor said, medicine is strongest when it chooses silence. Sometimes, saying no to a test is the most powerful kind of care. If this helped you see checkups in a new light, tell me in the comments, which of these tests surprised you the most? And if you value honest, science-backed senior health videos, hit subscribe to Science Pro Health. We uncover truths that help you live wiser, not worried. Because at this age, health isn't about chasing numbers, it's about protecting peace.